Here is something almost nobody tells you when your knees start aching more than they used to. It is not really about your knees wearing out like an old tire, and it is not simply the natural result of getting older, even though that is what most people assume the moment the pain shows up. The real reason often has almost nothing to do with the knee joint itself, and everything to do with something happening in a completely different part of your leg. Today, we are uncovering the hidden reason your knees may be hurting more after 60. And once you understand it, you will probably never look at knee pain the same way again. Stick around until the end, because this explanation changes what actually helps, and it is not what most people are doing right now. Before we get into it, if you find value in clear science-based health information like this, take a moment to subscribe to Longevity Insight. This channel exists to help you stay strong, mobile, and independent as the years go on. And we release new videos regularly covering exactly the kind of everyday health topics that make a real difference but rarely get properly explained. It takes 2 seconds, and it means you will not miss what is coming next. Now let us talk about your knees. First, let us look at just how common this issue actually is. Because if your knees have been bothering you more than they used to, you are far from alone. According to recent national health data, up to 30% of American adults over 45 have some degree of knee osteoarthritis, and more than 32 million adults in the United States are currently living with the condition. Globally, researchers estimate that osteoarthritis affects well over 500 million people, and more than half of everyone diagnosed with knee osteoarthritis will eventually undergo a total knee replacement at some point in their life. These numbers matter because they tell us something important. Knee pain in older adults is not some rare, unlucky outcome. It is an extremely common experience, and understanding what is genuinely driving it gives you a real chance to slow it down, rather than simply accepting it as an inevitable part of getting older. So, here is the hidden reason. Most people assume knee pain is purely a story about cartilage wearing away, the smooth cushioning tissue that lines the ends of your bones inside the joint, gradually breaking down through decades of use like the tread on a tire. And cartilage breakdown is absolutely part of the picture. That much is true. But here is what most people never learn. Cartilage itself has no direct blood supply. Unlike almost every other tissue in your body, which receives a steady flow of blood carrying oxygen, nutrients, and healing compounds, cartilage relies almost entirely on the movement of joint fluid to receive nutrition and clear away waste products. This means cartilage has a remarkably limited capacity to repair itself once damage occurs. Nothing like the way a cut on your skin heals or a strained muscle recovers. Once cartilage is worn down, your body has very little natural ability to rebuild it, which is a big part of why osteoarthritis tends to progress rather than resolve on its own. But that is only half of the hidden story, and it is not even the part that surprises people most. The other half, the part almost nobody connects to their knee pain, is muscle loss, specifically in the quadriceps, the large muscles running along the front of your thigh. Starting somewhere around your 30s and accelerating measurably after 60, most adults experience a gradual, ongoing loss of muscle mass and strength, a process researchers call sarcopenia. Some studies suggest adults can lose somewhere between 3 and 8% of their muscle mass per decade after 30, with that rate of loss picking up speed even further after 60, especially in people who are not engaging in any regular strength-building activity. This happens to some degree in almost everyone, regardless of how active they are, though staying active dramatically slows the rate at which it occurs. Here is why this matters so much for your knees specifically. Your quadriceps muscles act as one of your body's primary shock absorbers for the knee joint, helping control how force travels through your leg with every single step, every time you stand up from a chair, and every time you climb a flight of stairs. When these muscles weaken, more of that mechanical force gets transferred directly onto the joint surfaces themselves, onto that cartilage we just talked about, the tissue with almost no capacity to repair itself. In other words, weakening muscles around the knee can meaningfully accelerate the very cartilage breakdown that most people assume is simply happening on its own, purely due to age or wear. This is precisely why two people of the exact same age with a similar amount of cartilage wear visible on an X-ray can have dramatically different experiences of pain and function, depending largely on how strong the muscles supporting that joint happen to be. Researchers have specifically observed that individuals with weaker quadriceps muscles tend to experience faster progression of knee osteoarthritis and report higher levels of pain, even when the underlying degree of joint damage is comparable to individuals with stronger surrounding musculature. There is a third piece to this hidden puzzle as well, involving the fluid inside your knee joint itself, called synovial fluid. This fluid acts as a natural lubricant, reducing friction between the moving surfaces inside the joint and, as we mentioned, delivering nutrients to the cartilage. As we age, synovial fluid tends to become somewhat thinner and less effective at its lubricating job, partly due to changes in a compound called hyaluronic acid, one of the fluid's key components, which naturally decreases in concentration over the years. Less effective lubrication means more friction with every movement, which again circles back to accelerate the wear on cartilage that already has limited ability to heal itself. So when you put these three pieces together, cartilage with minimal capacity for self-repair, weakening muscles that shift more mechanical stress directly onto the joint, and joint fluid that becomes progressively less effective at lubrication and nutrient delivery, you get a much more complete and genuinely useful picture of why knees tend to hurt more after 60 than the simple explanation of just wearing out over time. And this matters enormously because it means the standard advice of simply resting a sore knee and waiting for it to feel better is often exactly the wrong approach, since inactivity accelerates muscle loss, which then places even more stress on the already vulnerable joint, creating a frustrating cycle where rest actually worsens the underlying problem it was meant to relieve. Now, cartilage and muscle loss are not the only factors at play here, and it is worth understanding the broader picture before we get to what genuinely helps. Excess body weight places significant additional mechanical load on the knees, and research has shown that every extra pound of body weight can translate into several additional pounds of force on the knee joint with each step, which is part of why even modest sustainable weight loss has been shown in multiple studies to meaningfully reduce knee pain and slow the progression of osteoarthritis in people who are overweight. Past injuries also play a substantial role, since a knee injury earlier in life, even one that seemed to heal completely at the time, can leave subtle changes in joint alignment or stability that increase the risk of developing osteoarthritis in that same knee decades later, a pattern doctors sometimes call post-traumatic osteoarthritis. Genetics contribute as well, with certain inherited traits affecting cartilage structure and joint alignment that can make some people more predisposed to knee osteoarthritis than others, regardless of activity level or body weight, which helps explain why some people with physically demanding jobs or histories of high-impact sports never develop significant knee problems, while others with comparatively gentler activity histories do. And low-grade chronic inflammation, a phenomenon researchers sometimes call inflammaging, tends to increase gradually with age throughout the body. And this background inflammation can accelerate cartilage breakdown within the joint over time, adding yet another layer to what is clearly a multifactorial problem rather than a single simple cause. It is also worth noting that knee osteoarthritis affects women somewhat more often than men, with some research estimating that well over half of diagnosed cases occur in women, a difference researchers believe may be linked to a combination of hormonal changes following menopause, differences in joint alignment, and generally lower baseline muscle mass in the surrounding musculature that all work together to stabilize the joint. This does not require intense high-impact training that risks aggravating an already sensitive joint. Research consistently shows that low-impact strengthening exercises, things like controlled leg extensions, wall sits, gentle squats within a comfortable range of motion, and resistance band exercises can meaningfully improve knee function and reduce pain over time, even in people with existing diagnosed osteoarthritis. Physical therapists frequently point to quadriceps strengthening specifically as one of the most effective evidence-based interventions available for knee osteoarthritis, often producing results comparable to some medications, without the associated side effects. For anyone who has been avoiding exercise out of fear that it might worsen existing knee pain, this represents an important shift in thinking, since the right kind of movement, specifically targeted strengthening performed consistently and within a comfortable range, tends to reduce pain over time rather than aggravate it, whereas prolonged inactivity tends to accelerate exactly the muscle loss that makes knee pain worse in the first place. Low-impact aerobic activity also plays an important role, and this might feel counterintuitive if your knee already hurts, but movement itself helps circulate synovial fluid throughout the joint, supporting the nutrient delivery process we talked about earlier, given that cartilage depends on this fluid movement rather than blood flow for its nourishment. Activities like swimming, water aerobics, cycling, and using an elliptical machine allow you to move the joint through its full range of motion while minimizing the direct impact and load that walking or running place on already compromised cartilage, making them particularly valuable options for anyone dealing with existing knee discomfort. Maintaining a healthy weight, as we mentioned, has a genuinely outsized effect on knee health, given the multiplied mechanical forces involved with each additional pound. This does not require dramatic rapid weight loss. Research has shown that even modest reductions in the range of 5 to 10% of body weight can produce measurable improvements in knee pain and function for people who are carrying excess weight. Anti-inflammatory nutrition choices are worth incorporating as well, given the role of chronic low-grade inflammation we discussed earlier. A diet emphasizing vegetables, fruits, fatty fish, nuts, and olive oil, similar to the Mediterranean eating pattern we have discussed in other videos on this channel, has been associated in research with lower levels of inflammatory markers and may offer a modest but meaningful benefit for joint comfort over time, working alongside, though certainly not replacing, the exercise and weight management strategies we have already covered. Proper footwear deserves a specific mention too, since worn-out or unsupportive shoes can alter how force travels up through your legs with every step, placing uneven or excessive stress on the knee joint. Supportive, well-fitted shoes, and in some cases orthotic inserts recommended by a doctor or physical therapist, can help correct alignment issues that might otherwise be quietly contributing to knee discomfort without you ever realizing the connection. It is worth adding a word here about pacing and consistency, since this matters just as much as which specific exercises you choose. Muscle strength around a joint does not rebuild overnight, and expecting dramatic improvement within a week or two often leads people to give up on a strategy that would have genuinely worked given more time. Most research on strengthening programs for knee osteoarthritis shows meaningful improvement over a period of 6 to 12 weeks of consistent effort, which is a timeline worth keeping in mind so that early modest progress does not feel discouraging compared to expectations of instant relief. Working with a physical therapist, at least initially, can also make a significant difference, since they can help identify the specific exercises most appropriate for your particular knee, your current strength level, and any other joint or mobility considerations, rather than relying on generic advice that may not account for your individual situation. Finally, it is worth knowing when knee pain deserves a proper medical evaluation rather than simply being managed at home. Pain that is severe, that comes on suddenly following an injury, that is accompanied by significant swelling, redness or warmth around the joint, or that has caused a noticeable change in your ability to walk or bear weight, all warrant a visit to a doctor. A proper evaluation, sometimes including imaging like an X-ray or MRI, can determine the specific degree of joint damage present and help guide a more personalized treatment plan, which might include physical therapy, targeted injections, or in more advanced cases, a conversation about surgical options. Though it is worth emphasizing that the vast majority of people with knee osteoarthritis can meaningfully improve their pain and function through the non-surgical strategies we have discussed today, particularly when those strategies are started before the condition has progressed to a more advanced stage. I want to leave you with this thought before we close. So much of the conventional wisdom around aging joints focuses entirely on what is happening inside the joint itself, cartilage wearing down, bones rubbing together, as though the knee exists in isolation from the rest of the leg. But as we have discussed today, some of the most powerful, most modifiable factors driving knee pain after 60 are actually happening just outside the joint, in the muscles that support it, in the fluid that lubricates it, and in the overall mechanical load your body places on it every single day. This reframing matters enormously, because it shifts knee pain from something you simply have to accept and endure to something you have genuine evidence-based tools to influence, starting with habits you can begin building today. If this video gave you something valuable today, I would really appreciate it if you took a moment to leave a comment below and let me know whether the muscle connection to knee pain was something you had heard before or whether it caught you by surprise the way it does for most people. Your comments genuinely help this channel reach more people who could benefit from this information, and they help shape what we cover in future videos. If you have a parent, spouse, or friend over 60 who has been dealing with knee discomfort, please consider sharing this video with them today. It might be exactly the insight they need to approach their knee pain differently, rather than simply resting and hoping it improves on its own. And if you have not subscribed to Longevity Insight yet, now is a great time to do it. We are building a community here focused on clear, practical, science-based guidance for staying strong, mobile, and independent at every stage of life, with more videos on bone health, brain health, and healthy hydration already on the channel and plenty more on the way. Hit that subscribe button, turn on notifications so you never miss a new upload, and I will see you in the next video. Here is to stronger legs, steadier steps, and knees that keep up with everything you still want to do.